fatal. If you've actually survived such an ordeal, that's great news.
Well, doctors say now all you need to do is to change your lifestyle somewhat, and they highly recommend that you take up cardiac rehabilitation program.
Now, just how does this help survivors of heart attacks and patients who have undergone major heart procedures? One such patient shares his story with us this morning. Henry Goh suffered a heart attack in May this year and underwent a stent implantation to remove a blockage in one of his major arteries.
And after sticking to a cardiac rehabilitation program at the National University Heart Center, he's now more energetic. And his doctor, Dr. Raymond Wong, also joins us in the studio this morning to tell us more about the program. Good morning, gentlemen.
Good morning.
So, what are the initial concerns for patients after a major surgery, such as ballooning, stenting, bypass surgery,
Are they
and valve
different for each
surgery?
procedure?
Good question. The initial concern is uncertainty. There can be multiple aspects of uncertainty. For example, they're unsure whether they're going to go through the procedure well, and when they do undergo the procedure, whether they're going to recover without any complications. And of course, how to get back to their daily life, their hobbies, what they used to do, what they like to do, and last but not least, whether they can return to vocation.
So for each specific procedure, it's not necessarily different. Rehabilitation is pretty much the same. What kind of rehabilitation are we talking about?
Well, in general, cardiac rehabilitation by design is individualized. It has to go with what the patient has gone through, the kind of physical ability that they have before the procedure and what they are after the procedure. And from there, we sort of do a prescription of the exercise program as well as a lot of education programs.
Henry, you went through an operation in which you had a stent and ballooning. Immediately after the operation, did you tell yourself, you had to do something different to your lifestyle and change your lifestyle?
Yes. On food, we have to change our food. Lifestyle, like exercise, we have to change, and especially the mindset is very more positive.
And immediately after the operation, were you a bit worried? I mean, how did you feel initially?
Oh yes, a lot of confusion and a lot of self-denial. And I don't believe that I have a heart attack actually. So after that, about 2 weeks, I come to accept it. Then I'm telling myself to be more positive.
Was that also at that point in time that you decided to join the program?
It wasn't there until I think someone approached me from the hospital staff. Then I think it's a good decision that I have joined the rehab.
Let's talk a bit more about that rehabilitation program, because I mean the confusion and sort of the worried feelings that Henry was talking about, I'm sure it's very common in cardiac. So can we talk through specifically what are the steps in this rehabilitation program?
Yeah, so what Henry described is what we call as a phase 1 of the cardiac rehabilitation program. And it takes place in the hospital right after the procedure or right after the heart attack, where it is education-based and as well as motivational based. We will then assess the patient's state of mind and try to encourage him that he can be better. And from then on, provide education. And this will involve the diet, the lifestyle, and what the patient has to do just to get back to the daily living.
So emotional counseling, but also advice on like diet and exercise.
Especially the risk factors as well.
The risk factors. And then after that, the long term, what kind of phases are we looking at?
And after that, that will be the phase 2 of the cardiac rehabilitation program. It still happens within the hospital, but as on an outpatient basis. This is purely voluntary for all the individuals who come forth for the cardiac rehabilitation program. In phase 2, there will be a structured 12-week program. 12-session program. Where the individual will be educated on the diet, lifestyle, risk factors, physical ability, traveling, driving for that matter, and of course it is heavily exercise-based because exercise is as a core component of cardiac rehabilitation program.
Sort of reinforce the message, basically.
Exactly.
I mean, changing a lifestyle is not easy. I mean, changing a diet especially and sticking to an exercise program, I've gone through that. Trying to stick to an exercise program, it's very difficult. Henry, how did you keep yourself motivated to change the way you eat? Because, you were so accustomed to that way of living for a long time and then, changing it practically overnight.
And put in effort, I would say, put in effort and be more conscious with what I eat, especially like those oily stuff, fries, those products with high cholesterol. So I mean, it's okay like that for health-wise. I think it's okay.
Okay, and then
eat more vegetable and fruits.
Sticking to an exercise routine, how is that challenging?
actually it's more on the self-discipline. Yeah, if you put in some effort, it's okay. It's not that difficult.
Dr. Wong, what are some of the techniques that you tell your patients, to do to try and stick to that, exercise regime and, to be self-disciplined? What are some of the techniques that you tell them?
Well, first of all, we assess the patient's motivational level, and a majority of our patients who join the program, they are motivated because they come forth to join the program. And on top of that, as a member of the multidisciplinary team in the rehab program team, we have a life coaching expert. Her job then is really to sit through with the patient some of the techniques that they can use to keep them in the program, to keep them adopting the lifestyle change, which is very difficult, as what you pointed out, and sort of to maintain that kind of a new lifestyle. And at the core of this change of lifestyle is a support group. Because in the support group, we have a group of individuals, mainly patients, but also the doctors and the nurses, who then join together and provide a very vibrant environment for the patients to share their feelings, to share their difficulties, and sort of continue with the program.
And this support group model is very successful because the people in the support group are going through exactly the same thing almost as you are. So how does that atmosphere help?
Well, some of them have become the champions. In other words, for those who have undergone the program and they have reaped benefit, like Henry here, he has volunteered his service to be a champion, and he then provide a living example in that sense of how one can take control of one's life and of heart condition.
Yeah, even with that support group, do you find that people, who
Is
could not stick to it and then drop down?
Rate? I mean,
There will be a dropout rate over time, but this is in a way one of the most effective methods that we can to keep people in the program. And of course, when we do see them in a clinic on a regular basis, like 1 to 4 months, we always then try to assess whether they are still in the program, whether they are still adopting the active lifestyle, which is very good for them.
One last question, perhaps some general advice for people like Henry going through, perhaps they haven't joined the rehabilitation group, but they want some advice on exercise and diet. Are there things that one should avoid in terms of exercise perhaps? Are there exercises that you shouldn't do full on, even though you just want to get fit after your surgery?
Unfortunately, yes. In fact, within the first 3 to 4 weeks after the surgery, less so for the stent implantation, but more so for the open heart surgery, within the first 3 to 4 weeks, they are only allowed, in that sense, to do activities that is required for the daily living. Toileting, dressing, bathing, including short walks outside the house. And it is after the 3 to 4 weeks when they remain stable and we assess them in the clinic and deem them very stable, then we will introduce them to a more full-blown kind of rehabilitation program.
Right. So it's not like,
Can't go straight from 0 to
straightforward
100.
That would be nice.
It might be our job then. Okay, thank you very much for your advice and thank you for sharing your experience, Henry. Now, our guests this morning have been Dr. Raymond Wong and Mr. Henry Goh, and they've been talking about, how to rehabilitate your cardiac health after you've gone through some serious surgery.